Perspectives on Fetal Alcohol Spectrum Disorder by Michelle Drati.
I'm a child of the Kagwantan and a grandchild of the Dukdantan, and I'm 19 years old. I'm an alcoholic. My mother drank 90 to 100 days during pregnancy, so I live with many of my own FASDs. I have both physical and neurological disabilities. I have spina bifida occulta, scoliosis, submucous cleft palate. My eyes focus at 2 separate times. I have other sensory integration problems. I have deformed hips. I have many learning disabilities. I have short-term memory. I have the overall brain development of an 11-year-old. It's not easy living with my FASDs, not just for me, but for my grandparents, because they're with me every step of the way. They're my external brain. They work with me, and they help me be successful.
Fetal Alcohol Spectrum Disorder, or FASD, has different effects on each individual. Some may need medical equipment the whole life, like Ariana in the top right, or have physical abnormalities, but many show no signs at all. So what is fetal alcohol spectrum disorder? It's an umbrella term that covers several disorders caused by prenatal alcohol exposure. We don't really know how many babies are born with an FASD, but it's estimated that 40,000 babies are born each year in the United States with an FASD. This exposure to alcohol causes permanent brain damage. It's often undiagnosed or misdiagnosed, and it's completely preventable. There are 3 main types of FASD. Alcohol-related neurodevelopment disorder primarily affects the brain and nervous system. Individuals will not show any physical signs of this disorder, but they can have intellectual disabilities, brain and nerve abnormalities, and behavioral or learning challenges. They will likely have delayed or absent neurocognitive development, have difficulty with adaptive functioning, and lack behavioral regulation. Neurobehavioral disorder associated with prenatal alcohol exposure will experience deficits in neurocognition, self-regulation, and adaptive functioning. They will also have confirmed exposure to prenatal alcohol use and display symptoms in their childhood, as well as experience significant impairments in school, social, and work environments. The disorder we hear about the most is fetal alcohol syndrome, which is a severe disorder on the FASD spectrum. These individuals will have the greatest effects of prenatal alcohol exposure. For an FAS diagnosis, the individual must meet 3 different criteria. One is that they will display 3 types of facial abnormalities, including a smooth upper lip, or philtrum, a thin upper lip, or vermilion border, and a small palpable features, or short distance from corner to corner of the eye, resulting in small eye openings. A second criteria is medical documentation of growth deficits, and a third is central nervous system abnormalities such as structural, neurological, or functional, or a combination of these. Structural abnormalities include a small head circumference and observable brain abnormalities, as seen in medical diagnostic imaging. Neurological problems cannot be from any postnatal conditions, illness, or any other neurological soft signs not from fetal alcohol syndrome. Functional abnormalities include performing far below the expected age or grade level and can include significant developmental and cognitive delays, executive functioning deficits, attention issues, challenges with social skills, and many more. FASDs are hidden disabilities. Often this diagnosis is not determined until the individual is an adolescent or older. Individuals are often misdiagnosed with ADHD or oppositional defiant disorder, for example, or never diagnosed. The stigma of an FASD means people will often not speak up about the alcohol use during pregnancy. The impacts from this disability can look different across the lifespan. The delays in speech and language development in childhood lead to poor social connections later in life. Lacking the cognitive development to make sound judgment, they tend to display unsafe or inappropriate behaviors. In adulthood, this could lead to arrest and jail time. These individuals tend to develop a mental disability, and without necessary support system, they end up homeless and have a substance dependency. In this one family, 4 children out of 6 have a diagnosis of fetal alcohol syndrome, in addition to other disabilities. Kevon, Jalen, Ray, and the other brother, who wasn't named, all have FAS. Each one of them has severe learning deficits, all are illiterate, and they all have communication challenges. Jalen has also been diagnosed with oppositional defiant disorder, while one of his brothers has ADHD, and Ray also has autism. All of them have microcephaly, or small brain. The brothers have experienced discrimination because of their hidden disability. They speak of people giving them judgmental sidelong glances and treating them like they are dumb. They get taken advantage of, such as not being returned the correct change after a purchase. They struggle with school and making friends. Living in a warm, loving home, their parents worry about their adult future and their inability to make sound decisions. Each of the brothers is different, with his own personality. They like to play sports, spend time with their family, be seen as good people, but most of all, they want to be treated equally, be given the respect that they deserve. These young men have dreams and goals and plans for success, and they won't let their disability hold them back. Their positive attitude pushes through past the disability. But ultimately, they lack the skills to live independently and do everyday tasks, such as paying for groceries. So how does this personal narrative help inform future practice? Looking at the biopsychosocial model, we can identify areas of strengths and barriers to engagement in occupations. We can see that these young men do not see their disability as a limiting factor. They have many features of a positive well-being, such as self-esteem, optimism, positive emotion, positive relationships, and resilience. And they have motivation. As occupational therapists, we can use these strengths and supports to develop effective interventions. Interventions such as attention training or rehearsal training to help improve memory. Parent and education training so that they can provide the best support for their children possible. And community-based interventions to help support them in independent living. We can also use activity analysis and grade and adapt activities in order to meet the needs of the individual. In addition, sensory-based interventions and environmental modifications can help reduce behavioral difficulties. Using our knowledge of FASDs and understanding the deficits present, we can identify the skills and services needed for their time in life.
Knowing and understanding where your deficits lie helps you build upon your strengths on mothers. And when I go out and when I speak, I always emphasize when it comes to fetal alcohol, they're only victims, never perpetrators.